Oh,
Can you hear us now?
Can you hear us now? I think we were muted.
Let me check.
Yeah, we're getting some messages in, so I reckon that's probably people
yes.
saying yes.
Sorry, everyone.
Okay.
I mean, I'm just trusting Sharon here. Can't get the staff, the
To the
assistant.
to the people online for some context, this is the third PC that we've tried so far today. So right, sorry. What I was saying to everyone online is that I work in comms very broadly. Communicating research is becoming more and more difficult. And I'm going to highlight some practical steps that we can take to battle kind of information overload. But first, I thought we'd look at some core principles. We do a lot of work on this internally at the Lancet. Um, so when we think about misinformation and disinformation, it's sort of almost impossible now to think about health and scientific comms in the modern era without thinking about the current state of how we come to know things, or as a former philosophy lecturer, as I would call it, epistemology. But modern scientific comms is currently really beset by these twin issues of misinformation and disinformation. And so the actual facts of how we come to have this shared understanding have really kind of shifted under our feet in recent years. Misinformation and disinformation are both fake news, but the difference kind of comes in their intent. Say I see something I think is useful posted by a friend on a social media site. I reshare it thinking it might help people, but actually the facts I'm sharing are materially untrue. That's misinformation. I didn't have an intent to deceive people, but I have. On the other hand, say I craft a post or an article which I'm aware, oh, Christ almighty. You know what? I'm just going to hold this here, which I'm aware contains misleading or false information, perhaps for gaining reputation with a particular group or even monetary benefit. That would be disinformation. Both of these are difficult issues, and they obviously sit on a kind of gradient of intention and knowledge. The result is that false information is shared, and we really find ourselves within this ecosystem when talking about health research these days. So these are the findings of a 29-country survey conducted on adults 18 and over by Ipsos. And they illustrate really a very real problem that people overestimate their own ability to know what is and what is not true, especially relative to what they think the average adult's capacity is to process the truth. Skepticism in verifying information doesn't always cohere with an accurate assessment of one's own capabilities. As medical journals, we try to communicate the closest thing we believe we have to the truth in scientific research, and that is intensively peer-reviewed research conducted methodically, flawlessly by experts with perfect oversight of their field. Now, obviously, that sounds ridiculous because no such research exists. Everything published, despite all the processes it's run through to confirm its accuracy, contains limitations and nuance. And when it comes to scientific research, there's no perfect, unimpeachable truth. And so journals kind of find themselves as one of many repositories of the truth in health, each of them battling to communicate health information to a skeptical public while retaining nuance and not overstating or simplifying the real issues every bit of verifiable health information carries with it. But then truth in society and how humans mislead other humans has always been an issue. Now, I mentioned that I used to lecture in philosophy, so a warning about the next slide. I'm briefly going to take you back to ancient times to illustrate how old discussions of societal truth are. Now, Plato in ancient Greece believed that the easiest way to organize society was by lying to the population about the content of their souls, which in his great lie dictated what a person could expect from their life. He said we should tell the population, God, in fashioning those of you who are fitted to hold rule, mingled gold into your generation, for which reason you are the most precious. But in the helpers he has mingled silver, and iron and brass in the farmers and the other craftsmen. Rulers are rulers, workers are workers. Now that, especially for a former philosophy lecturer, is a tragically simple reading of Plato, but it helps illustrate, I think, very early kind of lying and disinformation for the purpose of manipulation, which in this case was to create a just city in which every person tolerates their role. But you can see, as I put up on screen here, Plato's Republic actually offered a really early categorization of misinformation and disinformation. He distinguishes what he calls true lies, and these are false beliefs that reside deep in the soul about the most important matters. They're never accepted voluntarily, and they're always harmful. In today's terms, we might think of that as sort of internalized misinformation, sincerely held, but false beliefs about critical issues, like climate change, for example. Plato also describes useful lies, which are falsehoods told in speech, do not reside in the soul, and are not always harmful. And these include lies told to enemies, which is the first one there. It's kind of an interesting parallel with disinformation. It's deliberate strategic falsehoods like propaganda or state-sponsored fake news. Now, you might consider that modern disinformation on this reading is meant to disadvantage and and then you could think to yourself, well, more often than not these days, the enemy is the other political side. Second, Plato talks about apotropaic or protective lies, which are told to friends for their own good, like a doctor giving a white lie to encourage healthy behavior, or maybe public health messaging that might simplify the truth somewhat for clarity. And third, legends, stories about the distant past, told when the truth is unknown, but intended to serve a societal or educational purpose. The key point here really is that even in ancient Greece, there was this actual understanding that the intent, context, and impact of a falsehood is kind of crucial for coming to understand why we tell each other lies. Here's an example of persistence of misinformation over time. So when London faced the bubonic plague in 1665, people sought to protect themselves and loved ones from contracting the disease. One widely adopted method consisted of mixing 2 small cloves of garlic in with a pint of fresh milk. And here on the left, you can see a newspaper from 1665 talking about this protective remedy. People believed that drinking such a cocktail in the morning on an empty stomach would prevent getting the plague. But, like those living through the Great Plague of London, early on in the COVID pandemic, people were looking for things that could keep COVID at bay, which is why claims that garlic could cure or protect people proliferated on social media. The claims prompted the WHO to post these somewhat testy tweets saying that garlic could not prevent COVID infection, or as you can see at the time, it was called 2019 nCoV. Which fills me with the opposite of nostalgia, remembering working at the Lancet at the time that we started getting papers on 2019 nCoV. But you can see from this that where we have this sort of information vacuum, as we did at the beginning of the pandemic, information rushes to fill it. If we don't have the relevant scientific info, then public health is filled by a cocktail from 1665, which was meant to prevent the Black Death. This is another interesting one about misinformation around vaccines. The earliest attempt at something approximating a vaccine is when Edward Jenner discovered that previous cowpox infection conferred protection against smallpox in 1796. And these observations led him to develop a kind of early prototype of modern-day vaccines by inoculating patients with cowpox scabs. The treatment was obviously unusual. It set off a lot of rumours, which became the source of widespread scepticism and distrust. There was notable debate as well in the scientific community about safety and efficacy of these vaccines. The scepticism of the vaccine was obviously because we didn't understand the mechanism of action at the time. But also physicians began to observe smallpox infections in individuals who had already received the vaccine several years before. But Jenner denied the possibility of such thing as a waning immunity. And so scientific opponents retaliated to his denial by speaking publicly about distrust of the vaccine. It was also denounced by the clergy as unholy, which didn't really help. But this is a British caricature by James Gilray from 1802, which is an illustration of small cows sprouting from the sites of smallpox infection. It's called The Cowpox, or the Wonderful Effects of the New Inoculation. I put this here because not only is it an example of rampant disinformation for profit, but it's actually a really good story. We use snake oil as a common term now to kind of talk about deceptive marketing or naturalistic products aimed at health. But snake oil was one of the items that Chinese railroad workers brought with them to the States. And it was made from the oil of the Chinese water snake, which is rich in omega-3 acids that help reduce inflammation. Snake oil in its original form actually was effective. It's a good treatment for arthritis. The workers would rub the oil on their joints after a long, hard day at work. The Chinese workers started sharing it with the Americans, and they were very blown away by the effects of this snake oil. As word obviously grew, Americans looked to see where they could purchase their own snake oil, but there's no Chinese water snakes in the American West, so many healers began just cutting up rattlesnakes to make their own versions of the snake oil, which did not have the same properties. And you can see here a pamphlet from 1897 about a man referred to in common media as the Rattlesnake King. He claimed he'd learned about the healing power of rattlesnake oil. And he, at the 1893 World's Exposition in Chicago, cut open a live snake before a crowd of onlookers and became famous for that reason. However, several years later, the government intercepted a shipment of his snake oil, which he was selling to people, and found that it was primarily consisted of beef fat, red pepper, and turpentine. It didn't contain a drop of any actual snake oil, even rattlesnakes. When the government found this, they fined him $20 or $429 in today's money, and he accepted the charges. I mentioned previously that I worked as a journalist in Texas. We used to say in Texas that the tactics used by the Texan Republican Party in the state were sort of a preview of how national politics was going to go in 5 or 10 years' time, which I think has kind of proven to be remarkably prescient. Here's an example I think about a lot from back in, I think, what most people consider a simpler time, 2015. Jade Helm was a routine US military training exercise conducted in Texas and other southwestern states in 2015. Conspiracy theories spread online and across the media claiming it was a cover for a federal takeover, martial law, or gun confiscation. There was chatter on social media, on talk radio, and this theory of kind of an Obama-led hostile takeover of the whole state took hold. And then Greg Abbott, the governor of Texas, actually mobilized the entire Texas State Guard to go and monitor the training exercises, which then obviously lent immediate credence to the conspiracy theory. This was kind of a preview, I think, of how, with the wrong people in charge, misinformation rapidly escalates from fringe online spaces to mainstream political discourse. And it kind of really, for me, prefigured the dynamics of modern misinformation campaigns. Suddenly the fringes became the mainstream. But why is the modern age different? I mean, some major things are different now, of course. Social media has kind of democratized publishing. Anyone can put doctor on the front of their name on Twitter and start saying anything they like. Oh, X, sorry, as it's now called. Whereas legitimate publishing had usually been a kind of tightly controlled sphere. I kind of actually like to relate this democratization of publishing to the invention of the printing press in the 1400s, which of course led to the rapid spread of previously privileged information and discussions. You don't have to go down the printers nowadays, of course. Algorithms are also a novel feature, and they're code designed to show you things that will provoke the greatest reaction. They're kind of there for farming engagement and likes rather than creating a greater understanding. And they privilege emotion over reason and simplicity over nuance. It's also notable that lawmaking's not really caught up with this new form of social media. It's arguably not even caught up to the internet yet, to be honest with you. We're seeing less and less content moderation under the guise of freedom of speech, alongside the ability for posts to have an instant global impact, no matter from where they arise. It was quite illustrative to see last month on X, formerly known as Twitter, that they started showing where each account was posting from. And then the site's owners realized this meant that accidentally revealed that a lot of dyed-in-the-wool American patriots who were making thousands of dollars a month off X engagement were actually based in the Middle East and Southeast Asia. And then these changes were very quickly rolled back. But these are people, you know, contributing to the political back and forth in America. I really love this article featured here on the left by Jonathan Haidt in The Atlantic called "Why the Past 10 Years of American Life Have Been Uniquely Stupid." And he talks about algorithms and the extent to which social media in the early 2010s kind of started gamifying itself and changed tactics. And you can see in the last paragraph there, he spoke with a Twitter engineer who said that creating the retweet button was similar to handing a 4-year-old a loaded weapon because they encourage these mob dynamics and piling on. But an extreme example of how this can play out, in this case inside Facebook's profit-driven algorithms, was a surge of hate-filled misinformation targeting the Rohingya people, contributing to their genocide by the Myanmar military in 2017. The campaign actually included hundreds of military personnel working in shifts out of bases in foothills near the capital, posting on Facebook, creating troll accounts and news and celebrity pages, and then flooding them with incendiary anti-Rohingya comments at posts timed for peak viewership. And these were the tactics being used in 2017, so you can imagine what governments are doing these days. So on social media, you and I are kind of one voice among billions, and our visibility depends on our ability to ride the algorithm and provoke feelings in our fellow humans. And this incredible flood of opinion, belief, and information that we're all receiving every single day is referred to as an infodemic, and it's the situation that scientific journals, like the one I work for, find themselves dealing with in the modern age when trying to share important and scientifically rigorous information about health. The WHO defines an infodemic as characterized by too much information, including false or misleading information in digital and physical environments. It's what political operatives call flooding the zone, I guess. WHO go on to say infodemics are fueled by existing mistrust, but they foster further skepticism, creating a vicious loop that has the potential to hamper cooperation with health and government entities and resulting in outcomes that can potentially be fatal. I think scientific journals would like to see ourselves as these kind of neutral keepers of information, these kind of trusted sources that make all of you jump through a lot of hoops to ensure the information that we publish is in some sense true, no matter what it is. But as we've discussed, how people consume information and actually come to know things has changed. And methods of coming to know things are becoming overwhelming and decentralized. Given the sheer abundance of information on the internet from billions of actors and the diffuse methods in which people get their news, a shared reality is actually something we can no longer take for granted. And that's why, even at a scientific publisher, which has a main focus on just putting research out there, styles of comms and methods of comms are becoming more and more important. The more we actually let others drive communication about what we're publishing, the less control we have over the actual message. And that increases the danger for us as an organization. Journalism itself is grappling with similar issues, but a tendency kind of towards polarization within news organizations is creating a slightly different issue there. we would like to think of ourselves as scientific journals as neutral. But these are some of the issues currently being faced by scientific journals. I mean, issue number one is the sort of post-truth politics area that we find ourselves in. The people pushing the health conspiracies, at least in the US, are now in charge of health. This means they control the budgets, they control the dissemination of science, and they're pursuing their own agendas. It's a little bit like taking your ball and going home. The governments are unable to play by the rule of the game, as it's been played for centuries, and so are drawing up their own game, where only research supporting their views will be published. Because we as journals have not published research which supports their scientific beliefs, we're supposedly suppressing the information, and therefore we should no longer be respected as a publication. Here's an example. The American government is currently supporting the launch of RCJ, the Journal of the Academy of Public Health. It's a vehicle created to publish research supporting the Make America Healthy Again agenda, and thus legitimize its views by conveniently removing all the barriers to publishing good research. The scientific community really works as one to publish research which corresponds to best practice. The removal of that gatekeeping is sort of analogous to the decentralization of how media outlets got replaced by social media, these checks and balances being removed. But if it looks like a journal to the layperson, and it's therefore a lot more convincing than their aunt's Facebook post, but the standards are about the same. This kind of illustrates the issues that we have with debunking misinformation. Say that you have a journal article you're sharing, and the article says something not backed up by the research in the article, and the post says something not backed up by the research in the article itself. Do you think people are more likely to delve into the article to understand the scientific guidelines that haven't been followed? Or are they more likely to say, wow, a journal published this? I didn't know this medical fact before, but if they're saying it, then, well, it's a lot harder to disprove falsehoods than it is to post them. And it's crucially, for the purposes of using an algorithm, a lot more boring. Scientific journals themselves are having a little bit of a crisis, though. With so many journals out there offering a really low bar to publication and very little oversight of the published work, overall trust in scientific publishing has taken a hit. Major publishers want to publish more and more and more, and they want to have less and less oversight over it so they can get more and more papers out. Publishers have kind of created their own infodemic for profit. As an example of the quality bar in some legitimate journal publications, here are some meaningless AI-generated figures published in a now retracted paper. The generation and publication of low-quality work leads us onto the issue of AI, which is another unique modern challenge. Now, we get a lot of submissions into the Lancet Global Health on an impossibly broad range of topics. And us as editors will tell you that there's no way we can be experts in all of them. There's vanishingly few people on Earth who are both experts in the dynamics of Buruli ulcer, a neglected tropical disease, and the fragmented governance of health bodies in Southeast Asia over the last 4 decades. But I am, for example, currently handling papers on both of those things. I use search engines quite a lot, therefore, to find out quite niche medical information. And the AI overview at the top of search engines, you don't need me to tell you, is so often wrong that it's unbelievable. Often you can type in an association between any 2 random things, and the AI readout will tell you those things are definitely associated, and here's why. And then you look at the links it's quoting on the side and realize none of them reinforce the point the AI is making. A really kind of eye-opening one for me is when I started typing in health information, and it brought up an editorial I had written to prove a point that wasn't in the article. So it was sending my own work back to me with a complete misinterpretation. So AI takes information from scientific journals like ours, and it serves it to users in a way that contradicts what's being said in the journals. And that's because AI chatbots are actually programmed to keep you happy and to keep using them. They want to reinforce your beliefs and not help you understand and expand, your worldview. They're also very dangerous for 2 further reasons. One is that lay people quite often use them as substitutes for medical advice. And they can't account for things like patient history, comorbidities, clinical context. They can miss red flags and symptoms. And in substituting it, they quite often delay diagnosis or treatment or following up with practical medical care. Second, clinicians actually consult these AI models during patient care if they are confused or trying to diagnose a difficult condition. And often as a result, they can end up treating patients incorrectly, which is obviously very dangerous. Nevertheless, public professional and clinical understanding of the limitations of these AI models is really lacking. AI outputs aren't subject to medical regulation, they're not subject to peer review, they don't have any quality assurance, there's no accountability for errors or harm caused by chatbot advice. And they also, very importantly, perpetuate and amplify existing biases present in their training data. To bring all of this together, we're seeing more and more submissions across Elsevier and across the Lancet, which are blatant uses of AI. And that means that we have to put extra checks and balances in place to make sure humans have written the research that we're publishing. We've talked about the infodemic, but this is a really important publication from the National Academies of Sciences, Engineering and Medicine. They put out a consensus study last year, which aimed to examine the sources, the spread and the consequences of science misinformation. Problems they identified with how the information ecosystem operates include audience fragmentation, which is the rise of diverse media channels, which reduces the number of broadly shared information sources across audience. A really important thing that they highlighted was declining science journalism capacity. There's been a real reduction in dedicated science reporting at local levels, and that creates information voids, which is kind of a condition in which misinformation about science can more easily spread without these skilled reporters who are able to read papers and know what they're talking about. And also on digital technologies, the velocity, the volume, and the visibility of information has been really enhanced by new information and communication technologies like algorithms, which amplify sensational or misleading content. Then you've got participatory online environments like social media, and information inequalities as well was another thing that this report highlighted. I very much recommend you go and read this report. And that's historical and ongoing disparities in access to accurate, high-quality science information, which means that some communities are more exposed to misinformation about science than others. Look, it's difficult to communicate science, and it's never been more obvious than during the pandemic, when the understanding of what we were dealing with was being updated on an almost daily basis, and the scientific advice was changing along with our understanding. Use of phrases like follow the science were meant to imply that we were simply being scientifically led and that the scientific information might change, as we all know that it did. But the poor communications around the pandemic itself led people to believe that the science was in some way unimpeachable and fixed, which we know was not the case. Nevertheless, the general public don't always understand this, which leads us on to the problem of scientific illiteracy. As we publish everything online, and especially more and more open access, we become more and more a destination for the general public, who are kind of relatively unequipped to understand the nuance in the language of a scientific journal and how we interpret data. Here you can see an ONS table from during the pandemic. Can anyone point out how this data might have been misused and misunderstood by people during the pandemic? Well,
Looks like more ever vaccinated people have died.
exactly. If you look at this table as a person that doesn't know how to read scientific data, you would look, well, 28,000 people have been vaccinated have died, but only 3,000 people who are unvaccinated have died. So why am I taking the vaccine? And, in a similar way, we often find our publications misused to make points they don't support by people who don't read thoroughly. One of the most shared articles the Lancet has on social media is an editorial written by our editor-in-chief, Richard Horton, about COVID-19 being a syndemic, which is a collision of several different pandemics, which amplifies and worsens the situation. Now, his article was talking about how the COVID-19 situation is actually worse than you think, because we have all these different models interacting with each other. The article, unfortunately, has the title COVID-19 is not a pandemic. So there are tens of thousands of posts on social media sharing that headline with captions that say things like, even Richard Horton, the editor-in-chief of The Lancet, knows that we're all being lied to and that COVID-19 isn't a pandemic. Actually, the most common misinterpretation we face is that someone will share a letter that we've published on social media saying, The Lancet's the world's most prestigious peer-reviewed journal, and they say X and Y controversial thing or whatever. But the general public coming to our website don't know the difference between a letters page and a research article when looking at a scientific journal, which understandably, but that doesn't stop them sharing their opinion on these things. So Here's what we do at the Lancet. It's a 4-pillar response because, any good public health response has to have pillars in the middle of it. First, we look to kind of reduce these integrity risks at source. So we kind of maintain strong editorial standards. We have a lot of internal training about misinformation and disinformation. And we try and catch these errors before publication because that's definitely the best time to catch them. We're all human and mistakes creep in, especially when the pressure is on us to publish more and more and more. But we have this large and expert editorial team who, and I'm not just being paid to say this, are genuinely inspiring to see in action. We have a lot of internal Lancet peer review, as well as the peer review that we put papers through. So there's a forum of 150 Lancet editorial staff who look across every published paper across 12 of our main journals. So a lot of eyes go across these things, but things still get through. But it does help mitigate risk, and this kind of proactive prevention of false and misleading information entering the scholarly record is super important. It's a little bit like public health, really. You rarely get the credit for lives saved in broad public health measures because public don't see that side of it, but you do get the blame for the public health failures because that's the bit people can see. It's important for us as well, obviously, because the fewer mistakes we make, the less likely people are to say, well, the Lancet is a reliable source of information. We also really strive to kind of minimize the misinterpretation of our publications. So we don't stand back and let people lead the conversation without us, especially when it's about us. For example, we recently wrote an editorial in response to the false narratives put forward by the Trump administration about vaccines to support their withdrawal from Gavi, which used some publications from the Lancet to justify their withdrawal from Gavi. We put an editorial out, we heavily promoted it across lots and lots of different channels, just to get our version of what the actual truth is out there and kind of get this fact over fiction. If we think a message is complex and can obviously be misinterpreted by people with an agenda, we still publish complex, misinterpretable science for sure. Then we'll often organise science media centre briefings. For example, we had one recently on research we published about the measles vaccine waning, which obviously can be a misinterpreted publication. But we're really committed to accurate reporting, the avoidance of kind of scaremongering or sensationalism to the public, and this stewardship of our content. It's also important to us to use our editorial voice to call out misinformation. There's been a real increase in the editorials that we have to write about misinformation over the last kind of 5-10 years, obviously. But not only is it kind of lending our credibility to the fight against misinfo, but it's also helping educate the community, the researchers, the clinicians, to what to look out for. And we also try and strengthen the ecosystem through collaboration. One of the great advantages of working at the Lancet is sort of our convening power. So we're currently working on commissions with the Research Integrity Foundation. We're working on a commission on disinformation, health and human security with the WHO. And we even, I think, contributed recently to the Scottish Health Information Integrity Strategy in partnership there as well. So we try and help, bring our convening power and our name to work with other organisations to help fight against misinformation. But it's super important that we do, because, to summarise, we're struggling with legitimacy due to pseudo-journals that were created to publish scientific misinfo and low-quality predatory publishing practices. We're struggling with journals, that are working under an influx of AI, which isn't just misinterpreting our research and harming the health of people hoping to receive medical information and care, but it's also affecting how we assess submissions to us as well. Journals are becoming one source of many interpretation, even while trying to communicate their own published research. And the general public have never engaged more with health information, but they're not equipped to always understand what they're reading. But why is it important we get this right? This infographic's taken from a WHO Infodemic Management Pack. And it kind of shows how important it is that we continue to stay the course. Things we haven't mentioned already include the kind of necessity of producing public health guidance for authorities, operating with transparency, collaborating with other fields. But the last point on platforming the right kinds of expert voices is where my particular specialty comes in. I wanted to show this, which we use internally, which is a kind of excellent illustration of how one publication can have lots of different messages within it. So I, until recently, worked in the Lancet's comms department. And this is an example of all the multimedia that we can publish, which applies to, anything that we might publish and how we have to kind of craft the message to fit particular audiences. The Lancet generally has only ever been set up to communicate to medical professionals. most of what we publish isn't going to make sense to the general public, and kind of crucial information traditionally at the Lancet had been communicated actually via newspapers. So we had this kind of degree of detachment when talking to the general public. So I'm one of the people that kind of tried to drag the Lancet into the modern era a little bit. But we decided to use our trusted brand as a way to communicate accurate and helpful info to a general audience, as well as these established methods of communicating with a specialist audience. And to do this, I created this podcast called The Lancet Voice about 6 years ago now, which has had over 1 million listeners and across 234 countries since we launched it. And the kind of aim of it was to take the scientific accuracy of the Lancet and communicate the science that we publish to everyone, not just to the doctors that tend to read the Lancet. This has been a pretty intense balancing act since we started it. But I like to think it sits roughly in the kind of new scientist zone, people who are not necessarily scientists, but are sort of geekily, for want of a better word, fascinated by scientific progress. So why podcasts for this particular job? There's a kind of distinct lack of formality that comes from a good podcast recording, which should sound like friends chatting. I mean, that is, of course, far more engaging than reading an abstract. It also, importantly, I think, helps platform voices which have an important message who may not otherwise be getting published in The Lancet. A really good example is an interview we did with a dermatology clinic for people of color in San Francisco. While they hadn't published with the Lancet specifically, one of the Lancet's missions is illustrating how inequity plays a part in health disparities. We did an interview with the doctor who runs this clinic in San Francisco to find out why people of color require a separate skin clinic. And the reasoning is genuinely shocking. During medical training, most skin conditions are depicted on white skin and will present totally differently on skin of color. And not only, obviously, does that lead to differences in care, the problems that need fixing run deeper than that. Most cameras are actually only set up to accurately capture white skin due to a 1978 decision by Kodak to calibrate shadow and light using a photograph of their employee, Shirley Page, who was white. These are the sort of really fascinating stories, I think, that make this sort of mission of health publishing come alive to the general public. It also really helps us reach a different audience, as you can see there on the slide. Our average journal reader is a man in his mid-50s, but the average person that listens to a podcast that The Lancet puts out is a woman in her late 20s. So it's a really excellent way of accessing this completely different audience. The nuance is important as well, I think. Like, an abstract can really only tell you so much. And what's really fascinating and genuinely lovely to do in these podcasts is talk about the context of where a piece of research sits in the broader field, what the direction of travel is. It allows you to paste a single bit of research into a much broader context, which kind of in turn helps the listener understand that the scientific conversation is ever evolving. It's impossibly broad and it's open to its own kind of interpretation. Podcasts also allow us to use conversation to discuss limitations and place scientific research into a more helpful box of being one progress among many little progresses with its own problems that need considering. Now, all of these points are difficult and they require a firm editorial hand, but that's much in the same way that you might shape the editorial processes of a scientific journal itself. Now, you take the complete opposite tack. Why are podcasts a bad idea for communicating scientific information? I mean, for all the reasons that they're good, the opposite can apply. People love there being a fun conversation between friends that they can listen in on. But chats between friends, as we all know, aren't always the most well-referenced and informed debates. A lot of podcast hosts are also not journalistically trained and so can kind of indiscriminately platform people with harmful views, fail to ask them the right questions, and kind of lend this power by association. Also, the audience for podcasts is staggering, which is great if you can get your properly researched and fact-checked podcast out there, but no one is checking that. You can just publish a random discussion and have tens of millions of people listening to it. And there's lack of kind of journalistic training among podcast hosts who may have spent heavily on kind of professional level production and thus sound legitimate to the consumer can be really shockingly high. The other issue, of course, is that media training and knowing things are two very different skill sets. People can be global level experts and really bad at thinking on their feet and come onto a podcast and as a result say something very silly. Depending on the journalistic integrity of the podcast, they can find their words being manipulated by bad faith actors. And just as a result, some of the, as a related point, some of the cleverest people I know are completely unwilling to get in front of a microphone and talk about things because they just don't want to. I just think those are completely different skill sets. And it's part of my job for years was trying to persuade Lancet editors to host podcasts. And it was more, I learned a lot of techniques for dealing with anxiety over the last few years while helping those people out. But the thing is that misinformation on podcasts is big business. Now, these are the most listened to podcasts in the world currently. We've got the Joe Rogan Experience, we've got the Diary of a CEO with Stephen Bartlett, and this past weekend with Theo Von. Can anyone tell me what links these three podcasts together, apart from being the three most popular podcasts in the world? Well, they are all excellent vectors of medical misinformation. Joe Rogan, obviously, we all know about that. He says that ivermectin cures COVID vaccines alter your genes. And then when that was put to him separately, Joe Rogan said, no one should take anything I say seriously. Stephen Bartlett is an interesting one. He kind of started out with an inspiring how to make your business work, Diary of a CEO, but then pivoted into medical misinformation. He's got whole episodes on anti-vaccine conspiracies. He stated that COVID was an engineered weapon. He says that autism and polycystic ovarian syndrome can be reversed with diet. And he's stated as well that evidence-based medication is toxic for patients. And you also got Theo Von down there, who platforms people like RFK Jr. Just to have a nice chat with them. But people like RFK Jr. Their whole reason for coming on these podcasts is to spread medical misinformation. How am I doing for time, Claire?
You're fine, that's quite true.
Right. So how do we make podcasting work? Well, we're not interviewing in the journalistic sense. We don't do gotcha questions. I'm not inviting someone on to catch them out with a tricky question that I think contradicts their research. Engaged researchers actually enjoy talking about the limitations of their research and things that are important to bear in mind when considering the applicability of their research to the broader field, and we can discuss these things with nuance. And we want the science to leap off the page as well. We want to be able to communicate it to people in a way that's accessible, but that doesn't lose any of the nuance and doesn't dumb it down. We also don't want to criticize generally. We want to illustrate. Lancet podcasts aren't negative forums when it comes to discussing research. They might be when it comes to discussing the way people have acted, which has necessitated this health intervention. But, that's another thing. One underrated thing our podcasts do, I think, is they also engage authors. They make authors feel like we're not just churning out articles, but we're actually engaging with them and enthusiastic about their research, which we are. We are enthusiastic about your research. It's just that get lost in emails sometimes. We also publish practice-changing research on dozens of different topics, and often something that we publish can genuinely change people's lives. One example I always think about is a few years ago, I was involved in the comms around our commission on why Nigeria needs universal healthcare. Several months after the publication, Nigeria's government brought in a bill making health insurance mandatory as the first step towards universal healthcare by 2030, and they cited the Lancet's commission. Things like that are kind of what makes it a joy sometimes to work at the Lancet. But it's why I want to share these things with people on podcasts and get these comms out there. I also just love speaking to researchers. Even the most timid ones are really excited to talk about their research. But you have to kind of understand the responsibility as well of communicating on the behalf of not only the authors, but the journal, of yourself. It's an extension of the research that we publish, and it's got to follow the same rigorous standards. But speaking, as we just said, especially improvised conversations, is a very difficult skill, very different skill to writing. Being media trained is not the same as being scientifically trained. Usually we send questions to interviewees in advance to allow them time to think about their answers, and we also have to remain very aware of our own role in the conversation and not speak over people or talk to very knowledgeable researchers as if I'm on a knowledge level with them. It's quite fun having things explained to you by experts sometimes, though. Much as working in newspapers taught me to chase clicks, we have to resist that urge. Good quality podcasts don't come from a desire to have the most listeners possible by riding the algorithm and getting someone on to say something controversial. Good scientific podcasting is rarely controversial. We do have the odd big name, though, because sometimes I just do need to get people to listen to the podcast. I was saying to some of your colleagues who very kindly took me out for dinner last night that one of the silliest situations I've been in on these podcasts is that we had Anthony Fauci on for an episode, and he thought it was a video recording podcast. And so he turned up at a lectern in a full suit with flags either side of him for the recording of the podcast. And I was sitting there in my spare room in a t-shirt. So it was a very different experience. But it's important to platform voices who might not necessarily get published, like early career researchers and things like that, and understand the importance of platforming people as well with lived experience to talk about the issues that affect them. For example, generally when we talk about health issues caused by a humanitarian incident, we'll strive to get someone on from that country or group to talk about it rather than a commentator. This kind of goes back to the awareness of, of yourself, but it's very important to me that I don't end with a summary which summarizes the issue according to me. I don't think anyone wants to hear my opinion on an issue that I don't know anything about. We also have to adhere to Lancet editorial standards. Like sometimes guests say something which we wouldn't usually write in the Lancet, for example, criticizing a specific person or company, and that obviously has to come out. We also always get at least one other person, kind of a mini peer review, to listen to each podcast that we publish, because, usually by the end of editing a podcast, you're really bored of listening to it. And that can kind of let something slip through unnoticed. And that's the best way to make sure you don't publish something that you don't mean to publish. I also wanted to, now that I'm at the Lancet Global Health and running their podcasts, the Lancet Global Health really focuses on disadvantaged populations exclusively. And we're committed to addressing the decolonizing agenda in a field that was so heavily colonial. It was up until recently called tropical health. For this, I need an in-depth understanding of my own prejudice and the ways in which I think, which can be detrimental to letting the person I'm talking to telling their story. Even just the act of choosing, which is obviously conducted by me as the podcast host, excludes some people and makes me think to myself, why am I excluding that person and platforming this one? What is it about the way I think about these two situations that shows my bias? It also means that we have to use more personability when talking about the research that we publish, because often in our journal it's done on incredibly disadvantaged groups. If you compare our pages, for example, to the Lancet Oncology, you'll see that a lot of medical research in the Lancet Oncology is done for expensive solutions in high-income settings, whereas more often than not, the Lancet Global Health, we're discussing low-cost interventions in resource-limited settings for what high-income locations would consider very basic healthcare. I was just talking actually to someone about a paper that I'm handling on blood transfusion in Kenya. And the thing that really blew me away about that paper is that often patients in Kenya aren't released from the hospital until their friends or family have replaced the blood that the patient received during blood transfusions. So things like that you don't consider because of the privileged position that I come from in a high-income country. And, also, of course, we're serving an entire global community, and that's got real repercussions. I also wanted to include a bit at the end about practical steps for researchers, so kind of like lessons for psychoms overall. So these are some things you can take away on how to communicate your message. I think the game has kind of changed, really, and social media like Facebook and X isn't going to cut it anymore. Funnily enough, and this is going to sound really tedious, we are seeing the biggest success reaching people who need to hear the message, like policymakers and clinicians using LinkedIn, which seems to be where all the professionals are these days. It's not a great platform. It's full of pseudo-inspirational speeches and people that you wouldn't talk to in the pub. But if you look closely, there's a community who are interested in your message. It's also worth approaching the Science Media Centre to see if they can help sort out a briefing, or if they can provide an up-to-date list of journalists who might take a direct pitch rather than sending out a press release as we've done in the past. At the Lancet, we have an excellent comms team, so if you're publishing with someone like us, it's worth asking as well what we can do to help. And I've written here, but I'm not sure about it. There's nothing to stop you starting your own podcast. And I mean, as for the message itself, I hope I've got across that it's very important you communicate honestly, openly, and transparently. Be prepared to demonstrate nuance and resist your message being boiled down to a simplified version. Health research has got to lean into complexity. And then it has to be ready to correct the record when that complexity is misunderstood. But you also really have to avoid engaging with bad faith actors who are now all over social media. And to some extent, the press. It's full of people who aren't interested in getting a nuanced and complex public health message out there, but they are very interested in using your work as fodder for advancing their own agenda. There's little to no point in arguing directly with these people. Produce your own correction of the record on your own platform and move on. I thought I'd show you some of the things that we use internally to look at tackling misinformation as well. While context is key, preemptive interventions seem to be more effective in the misinformation research that's been published recently. This is because kind of misinformation can be quite sticky and hard to unpick once it's seen or heard. And fact-checking efforts, as we said, don't go as viral as mis or disinformation. Debunks are not distributed to everyone who's heard or seen the original misinformation, and debunking is less engaging. Messaging that contains nuanced, important truths is not emotionally, morally, or politically charged. And those are qualities that make things more compelling online. So these are some examples from an article by Sander van der Linden, who is quite prominent in the misinformation research field now, that show different ways that you can have of combating false beliefs about health. So you've got a kind of forewarning there, telling people in advance they might come across health information that they can that can be used to manipulate. You've got a fact-based inoculation, which tackles the particular facts of the bit of misinformation. You can have a technique one, which looks at the technique that people are using to share the misinformation. And you can even share what they call a microdose example, which is an example of how this sort of misinformation went viral before. This is a really interesting and fun tool you can try, which is kind of, again, created by Sander van der Linden. It's a quick game you can play, designed to show you how easy it is to spread misinformation online, and in doing so, make you more aware of the tactics used by people purposely spreading disinformation. Sander's research sheds light on the possibility of inoculating people against misinformation by forewarning and exposing them to a weakened dose of the attacking material alongside persuasive refutations. It works as a psychological vaccine against disinformation. Playing it builds cognitive resistance against common forms of manipulation that you may encounter online. In this game, each chapter represents a technique or method often used in misinformation or misleading information. Inoculation is not only possible in the context of controversial issues, but we should conceptually distinguish between therapeutic and prophylactic forms of inoculation, depending on whether and how often people have already been exposed to potential misinformation. As well, there is another field of thought on misinformation, which is that we need to deal with it on a more public health societal level. And this is a really interesting paper published in Nature, which if you scan that QR code there, will take you to a toolbox of kind of public health level interventions against misinformation. And kind of it's used as a resource for educational programs and for individuals who wish to practice self-nudging to stop misinformation. But the versatility and diversity of interventions in this toolbox really increase the likelihood of addressing different needs, preferences, and skills of different users. Whereas in individual level approaches like the ones we just discussed, like pre-bunking, aim at mitigating misinformation by acting on individuals' ability to recognize and not spread falsehoods. These system-level approaches can actually aim at making the entire online ecosystem less conducive to the spread of misinformation. For instance, through platform design, content moderation, communities of fact-checkers and journalists, and high-level regulatory and policy interventions. And that is it from me. Thank you very much for listening.
Thank you. Okay, so I have Sharon's phone for any online questions.
Oh, I can look at them here as well, can't I?
Type any in the chat. But does anyone have a question in the room, first of all? Oh, you stunned everyone.
No, everyone's just happy. That's always a good sign, right?
Okay.
Really interesting and just, yeah, makes us think so much about many of the challenges. You mentioned that people often quite, well-known or well-recognised scientists quite hesitant to do podcasts.
Yeah.
And one of the challenges there as started actually Claire found in doing work indeed, and we found in doing working on COVID that it's really easy to suddenly find yourself at the end of a pylon. So I think people are more and more concerned about that in terms of the impact it can have socially. What do the Lancet do to try and help people navigate that or protect them from that kind of thing?
Yeah, we have had to work with researchers on that in the past. When things get misinterpreted, we were talking before on things like, X, where people just end up retweeting hundreds of things and then organizing massive pylons or whatever. Really, like I was saying, it's not worth engaging with these bad faith actors a lot of the time, but obviously it is kind of devastating for the researcher to deal with. So all you can really do is kind of correct the record on your own social media or platform. Just make a kind of clear statement about what it is you were trying to say. And rather than engage with the pylon, it's just to kind of move on. But it's a lot easier said than done, isn't it? Yeah.
Is there anything you think can be done about the kind of proliferation of the kind of podcasts you were talking about then, the ones that have misinformation?
It kind of, I wish Apple and Spotify moderated podcasts more that ended up on their platforms, but it's never going to happen. You can see Spotify signing whatever that like $300 million deal with Joe Rogan for his podcast to be on their platform was. So that sort of moderation and kind of like fact checking is not going to occur on podcasts. So that was why I sort of thought we had to fight back a little bit by putting out podcasts that were rigorous and scientific, just in an attempt to steal part of the market back from them and not leave that kind of scientific information vacuum. As I'm saying that, I realize how naive it sounds, but it does seem to have worked a little bit at least. But there's not much you can do to stop the big boys constantly saying things about health, I think.
Yeah, presumably the audience is quite different for those podcasts than for you.
Yes, that's the thing, isn't it? But the more you can get these podcasts to listen to, the more kind of knock-on effect it has. We put episodes out now and we see people talking about them on social media or whatever, and it's almost always kind of positive or, wow, I didn't think about it being explained in that way, or it's great to hear the nuance behind this topic. But yes, those aren't the sort of people who would be listening to those podcasts anyway. So no, I don't have any easy solutions for that.
Any other questions? No. Okay, I guess we just finished it because we're nearly at 3 o'clock anyway. So thank you so much for coming to talk to us. And or someone, is it record? Yeah, we'll have a recording, won't we, Audrey? Yeah, and bad backs to Australians or something. Thank you so much.
All right, thanks everyone.